Generally, we have a bit of a high unmet need for family planning in Kenya. But specifically for chronic diseases is that these women have a lot of issues with either diabetes, hypertension, heart lesions, cancer, that we don't think that they should have an extra stress of having to worry about an unintended or an unplanned pregnancy.
The problem we found was that women with cancer, diabetes, heart conditions, high blood pressure, or an anticoagulation therapy were more likely to be turned away from traditional family planning service delivery points because providers were uncomfortable in counseling them. However, these are the very women at highest risk for pregnancy complications.
So we did something really simple. We got space and a dedicated nurse from the hospital right where the women come to receive their care. When they come to see their provider, they refer to the family planning clinic. Here, the women receive family planning counseling that takes into consideration their medical condition, and they receive a method of their choice at no cost. Our goal is to encourage women to use a long-term method like IUDs and implants. And so far, we are happy with the results. In our first year, we saw around 1,000 patients. Of these, 40% are now opting to plan their next pregnancy using a long-term method of family planning.
We usually give family planning methods in this room. These are some of the valuable methods we usually give. We have microgynon, then we have the microlute, which is given to mothers who are breastfeeding. We have got two types of implants. We have Jadel and we have Implanon. We also have an IUD, which is a copper T coil inserted inside the uterus. It takes approximately 10 years, but it can be removed anytime the mother wants it removed. We have got male condoms here. We have got the female condoms. We also have injectable. This is Bepo. It's an injection that is given every 3 months.
In pediatrics, we know that one of the child survival programs that has shown a lot of support in ensuring that there's reduced mortality in under 5s is breastfeeding. And so when family planning is taken up by moms, it allows for uninterrupted breastfeeding, because we advocate for exclusive breastfeeding for the first 6 months as per World Health Organization guidelines.
We also deal with other patients who have coagulation problems, either DVT or pulmonary embolism, also who have diabetes and hypertension. So all these mothers come to our clinic to get family planning counseling, sometimes just information, and sometimes actually take up a clinic. In this way, you actually prevent a lot of pregnancies that would have worsened the condition that the patient had.